Newborn skin color. Why does it change? Newborn skin color can vary significantly from baby to baby and is influenced by a combination of genetic factors, gestational age, and environmental conditions. Also, your skin gets its color from a pigment called melanin. Here are some common skin color variations seen in newborns. Pink or red. Many newborns have a pink or reddish complexion, especially during the first few hours or days after birth. This rosy hue is often due to the baby's circulation adjusting to life outside the womb. Pale or mottled. Some newborns may have pale or mottled skin with uneven patches of color. This can be a normal response to changes in temperature or circulation. Jaundice. Jaundice is a common condition in newborns, characterized by a yellowish tint to the skin and eyes. It occurs when there is an excess of bilirubin in the blood. Jaundice is usually harmless and often resolves on its own, but in some cases, it may require monitoring and treatment. Cyanosis. Cyanosis refers to a bluish discoloration of the skin, lips, or nails and can occur in newborns if they are not getting enough oxygen. It is important to seek medical attention promptly if you notice any signs of cyanosis. Erythema toxicum. This is a common newborn rash that appears as small red or white bumps on the skin. It typically occurs within the first few days of life and resolves on its own without treatment. Mongolian spots. These are bluish-gray birthmarks that are more commonly seen in babies with darker skin tones. They often appear on the back or buttocks and usually fade over time. Birthmarks. Some newborns may have birthmarks, such as stalk bites, pink or red marks on the forehead or back of the neck. Oh, strawberry hemangiomas, raised red or purple marks on the skin. Skin sensitivity. Newborn skin is delicate and may be sensitive to various irritants. It is essential to use gentle and baby-friendly skincare products and avoid prolonged exposure to direct sunlight. When does a baby's skin color stop changing? How does the color evolve, and what determines the final skin color? And how do we handle people's views of our children's looks? When does baby skin color stop changing? Over the coming 6 months or more, the baby's true skin color will develop, which is entirely controlled by genes and not something we can control at all. A baby's skin should fully settle by 20 months of age. What determines a baby's skin color? A baby's skin color is a polygenic trait. This means that it depends on more than one gene. A baby receives half of the genetic makeup from each of his parents. His physical features come from the dominant genes of both his parents. This combination will ultimately determine the baby's skin color. What not to do? Since your baby's skin color is determined by genes, there is no way to change or predetermine it. If you hear recommendations for the use of fairness creams, talcum powder, or different types of homemade creams, you can be sure that they won't work and they may hurt your baby's skin and lead to skin irritation. Most babies are relatively fair when newborn, but depending on race and genes, the baby's skin then changes during the first year to its real color. So there is no need to worry at all. There isn't much you can do about it. I know there are old recommendations to massage babies with, for example, milk powder, to make the skin fair, but that doesn't help at all. These recommendations are all pure myths. It's important to note that newborn skin can change in color and appearance during the first few weeks and months of life. In most cases, these variations are normal and not a cause for concern. However, if you notice any sudden or significant changes in your baby's skin color, it's always a good idea to consult a pediatrician for an evaluation and reassurance. Let's empower each other to focus on the inner and outer beauty of our children, no matter the color of their skin.